Radhe Radhe and a very warm welcome to everyone for our Friday Health webinar series. Today is a very important topic. It is about back pain and how to deal with back pain. And we're very thankful and grateful to Dr. Sanket Vyas ji. He is going to do the presentation and he's also going to answer the questions related to back pain. A brief introduction about Dr. Sanket Vyas. He is a doctorate of physical therapy. He completed his doctorate from Utica College in New York and he has been practicing for the past 14 years. Dr. Sanket Vyas is also a certified in big and loud therapy, specially designed for Parkinson's patients. Currently, he is managing two outpatient clinics and is also seeing post-operative patients for recent back, neck surgeries, and joint replacement from Baylor Scott and White. He is also skilled in performing dry needling, manual therapy, diagnostic ultrasound, cupping therapy, lymphatic drainage, and vestibular training. He is married to Nirzari Vyas, who is also a doctorate of physical therapy, and they have two beautiful daughters, Mahi and Sia. He loves traveling with family and spending quality time with them. He also loves reading self awareness books. So, Dr. Sanket Vyas, we are very happy to have you on this platform, and we are very grateful to you for having taken time out of your very busy schedule to educate our community on the importance of good postures and also about how to avoid back pains. Thank you, and without further delay I will pass it on to you to lead us into the presentation.
Right. No, it's my pleasure to be here. And thank you for giving me opportunity to explain this such a common topic, but still very misunderstood topic. So I can go over and explain in detail today that, and I hope I'll try to cover all the aspect of the back pain, most of the question that I hear at my clinic that in daily basis that people ask me. So I try to include all those questions and try to include some of the very basic assessment tools as well. So I'm gonna go over there with that one. So I'm gonna start with some of the uh, basic topics. So I'm gonna today cover some of the topics like myths and facts, that what are the myths and misconcept of the back pain, what are some self-assessment tools that you can do, some of the professional help, that when you should seek the professional help, when you should be looking for a doctor or physical therapy help, what types of back pain. There are many out there. Most of the time people I hear like, I have a herniated disc. What is that? I have a stenosis. What is that? I'll explain that. I'm gonna go over in basic ergonomics, posture, how your posture should be when you're laying down, how your posture should be when you're sitting in the office. I'm gonna go over the exercise and treatment because it has to be specific exercise and treatment. So I'm gonna go over that one. So I'll start with the myths and the facts. That I would say more like a misconception than the myth. So many times I hear at the clinic that the back strain will get better by itself. You're working in the backyard, you're sitting on the desk whole day, and sometimes you just strain your back and you think it's gonna get better by itself. Yes, there are chances that in some days it will get better. But if your pain stays there for more than a couple of weeks, then it's nothing that you wanted to definitely look for some more help at that time. So it's not gonna get better by itself at that time. So your pain, your acute pain that initially that you just had a little strain, if you ignore for a certain time, that acute pain is going to turn into chronic. And then you're just gonna be in a cycle. So if your pain stays more than 2 weeks, you wanted to definitely take that as a seriously. The second, I hear a lot about yoga and Pilates, which is good. Yoga and Pilates is a good way to strengthen your back. but not all the poses are good for certain condition, because I get many patients who hurt it by just watching some videos on the YouTube, and then next day they're in more pain than before. For example, I will tell you, like if someone has a stenosis, and if you're not aware of that, like have a stenosis, I'll go over what is stenosis later on today. But if someone with that kind of situation should not extend their spine. Now, if you see in the slide, it says it's a cobra pose. So that is very common in the yoga poses. But with the stenosis, this is not good. It's going to aggravate your pain. It's going to increase the pressure on your canal, on your lumbar, and that's going to make the pain worse. So to preventative care, if you don't have a back pain and if you're regularly doing yoga and Pilates, it's very good. It's going to help you to strengthen your core, stabilize your core. It's very good. But if you have any acute pain, you just started getting more pain, then you want to be very careful what kind of poses you do when you're going for yoga or Pilates. The third one is the massage. I hear many times that I'm just gonna go with the massage and it's gonna get better. It's gonna relax my back. It's gonna make it much nicer. It helps. It's more like a maintenance. I also have some at my center. We have some massage room as well, but like that is more maintenance. So if you have a strained muscle, if you go for a massage, it's gonna relax the tendon. It's gonna relax the muscle. But if you have a more issue like a nerve involvement, some impingement, sciatica pain, so it's going to help you only temporary. It's not going to help you for a long term. So you're feeling going to feel better for next 24 hours. And after that, immediately you're going to start getting pain again. And after some session, you'll say, oh, I've been going to the massage, but it's not helping me. But the massage is not to cure your back pain, is to kind of maintain the strain on your body throughout the daily basis activity that you do. So massage helps you to relax your body. So that's the misconception that I hear many times here. The second is the pain medication. I hear many times that, okay, I'm gonna take the medication and it's gonna get better. Not only hear that, but that's very common practice right now. If someone heard it, if they wake up with a stiff back, or if they feel like in a little strain on the back, the first thing we're gonna do, oh, I'm just gonna take a Tylenol, Aleve, and it will go away. Yes, it will go away temporarily, because what the medication does, it masks the pain. It's not gonna just like, treat the root cause. So with the medication, you wanna be careful, because if you start using more and more and more medication, then there are side effects of the medication, and eventually it's gonna stop working. Your body get resisted to the medication. So we wanna be very careful at that time. Temporary, fine, but you want to be very careful with medication. The next misconception is that core stabilization, core strengthening. I hear this a lot. Like, I have a back pain, all we got to do is strengthen the core. The core strengthening helps, yes, but I get many patients, athletic patients, some regular gym goers who have really toned body, six pack, like really, really nice body, but they hurt their back. How? If they have a wrong posture, they're doing the squats, or they're doing some activity or exercise which cause extra pressure in the wrong posture, that's gonna really injure their back. So it's very important that, like, that not only strengthening exercise for the back pain, you have to thoroughly assess it. The other one is this, some of the fact that now these are all the misconceptions. I'm just gonna go over some of the basic statistic of the back pain, that how common it is. So some of the basic numbers are like, more than 250 million people miss their work due to the back pain. We also lose our muscle mass 5% every decade after 30-year-old. So that does affect, if you're not active, if you're not regularly doing exercise, so that's going to affect you. Stress and anxiety, that is very, very important, because in this kind of life, particularly with this COVID-19 and all situation, the stress and anxiety does increase your back pain. So if you have a strain on your back and if you have anxiety, yes, it's gonna increase you more pain. There are about 50 billion people suffer from the back pain. $50 million are spent on the back pain every year. So you can imagine the financial toll on the institutes. And also they're saying that 80% of the population will suffer once, at least in their lifetime, the back pain. So that's a quite an amount of number, 80% of the population. So these are some of the basic statistic that I wanted to discuss and share with you so you can understand the gravity of the situation of the back pain. Now I'm going to discuss about the self-assessment of the back pain. So what I'm going to discuss is two basic questionnaire that we use on a regular basis. One is the START back screening tool, and the second is the Oswestry low back pain disability questionnaire. I'm going to go detail on this assessment, that how you can do it. So when I get a back patient, so I see the patient, these are the tools that we use the first. It's a gold standard, so it's very, very universally used. Even the evaluators, the payers, means like insurance companies, some of the hospitals, they use this form to determine what kind of situation the patient is in. So I'm gonna go with the first one, which is the START back screening tool. So this one has very basic questionnaire. It does include psychological factor as well in this one. So what this one does is that it gives you your severity of the back pain. Like how severe is your back pain? Is it in a low category? Is it in a medium category? Or is it a higher category? If it's a low category, you can treat it by yourself. You don't need to seek any professional help. You can do some stretching, some basic ergonomic follow-up, and you'll find. If it's a medium or high risk, you definitely wanted to see some of the professional help. So the medium risk can easily be treated with the physical therapy treatment. With the high risk, yes, it can be treated with the physical therapy, but it has to be like a little bit extensive treatment. And also we have to consider many factors in that one. So there are 9 questionnaires in this tool. If you are, you can Google it. It's a very basic tool. So it's a START back screening tool, but you can see on the screen as well that I put down some questions. So the first question is, my back pain has spread. So this question you ask for last 2 weeks. So in last 2 weeks, how did you feel? My back pain has spread down to my leg at some times in the last 2 weeks. I have pain. So you agree or disagree. It's yes or no question. So you point yourself like 0 or 1. I have had pain in the shoulder or neck at some time in the last 2 weeks. I have only walked short distance because of my back pain. In last 2 weeks, I have dressed my more slowly than usual because of the back pain. It's not really safe for the person with the condition like mine to be physically active. Okay, as I said, this is also some psychological factors involved in this one too. The 6th question is, worrying thoughts have been going through my mind a lot of the time. I feel that my back pain is terrible and is never going to get any better. And the 9th one is, in general, I have not, the 8th one, in general, I have not enjoyed all the things I've used to enjoy. Overall, how bothersome has your back pain been in the last weeks? And that you're gonna answer like, not at all, slightly, moderate, very much, or extreme. So based on this score, let's say your total score is 5, okay? And your sub score is 3, okay? So the next one, we're gonna see that how we score. So the total score is 5, okay? So that is in the next category. So if you score 3 or less overall, then you're in the low category, okay? Yeah, so if you see like total score, if you enter your score of 5, total score, then it's, if you score 3 or less, then it's a low category. And let's say you score 5, then it puts you on the other category, which is 4 or more. Then we use the subscore, which is from question 5 to question 9. So we add those score like in this one. So let's say your total score is 5 and your subscore is 2. Okay, so 3 or less total subscore is a medium risk, and if you score 4 or more, that's a high risk. Okay, so that's how you're gonna assess yourself, that whether you fall in a low category, medium category, or high risk category. Based on that, it can tremendously help you to avoid unnecessary trips to the professional clinics or doctor's offices. Because if someone come here with the low risk, I'll just tell them to do some exercise at home, to follow the ergonomics, to make sure their posture is right and they're good. But if someone is a medium risk, I'm going to start assessing, start asking more questions. I'm going to start doing some special tests to find out more that what causing more pain. The high risk, of course, we're gonna go thorough assessment about the history and all, and then we're gonna go from there. But based on that, we can really predict that how long the treatment can be lasted. So this is the, that one is the start back screening. Now the other questionnaire is the Oswestry Low Back Pain Disability Questionnaire. So I'm gonna share my screen for that so you can understand what I'm talking about. Okay. Okay, can you see my screen?
Yes.
Okay, so this one is the Oswestry Low Back Pain Disability Questionnaire. So there are 10 questions. You can go over the question later on. You can, as I said, just put the name in Google and you can find this questionnaire. I'm just gonna explain like what it is and how you can use it. So there are 10 questions. The first is pain intensity that you answer from, there are 6 possible answers from 0 to 5. So you score 0, 1, 2, 3, 4, 5. Same way you're gonna go over like personal care, lifting, walking, sitting, standing, sex life, social life, sleeping, traveling. So there are possible 50 answers because as I said, 0, 1, 2, 3, 4, 5. So 5 is a maximum score. There are 10 questions, so the total score can be 50. Now what you do is, for example, let's say your score is 10. You answer all those 10 questions and averagely all the questionnaires are number 1. Okay, so there are like 10. So if you scored 10, then your disability, so basically you divide by 50 and multiply by 100, so you get the percentage. But if your score is 10, then your disability score is minimal disability. So this, many insurance companies, many hospitals, many clinics use this score to identify where the patients stand. Even this score can be used like, to go back to the work. Like, are you safe to do the work? How disabled you are. So let's say your score is 10 or less, then you fall in this category, the minimal disability. If you score from 11 to 20, then you fall moderate disability. If you score 21 to 30, then you're severe. If you score 31 to 40, that's more crippled because you cannot do many things. And if you score 100, that's more like a bedridden. So you can read all this detail and you can understand like, what it is exactly. So this really helps to understand the basic score about the back assessment. All right. I'm going to go back to presentation. Okay, so now I'm going to talk about the sciatica and the piriformis syndrome. This is also very commonly question asked. Whenever a patient has any burning pain down to the leg, they said, okay, I have a sciatic pain. Or if I have any back pain, that's a sciatic pain. Not necessarily, because it can be, but it could be. There is a other syndrome is called piriformis syndrome. So I'm just going to show you first, like, just video about the piriformis syndrome, that what it is. So you understand exactly like, what is the piriformis syndrome. So I'm going to share my screen one more time. Can you see my screen?
Not yet. Yes.
Okay. So this one, I'm going to show you exactly what is the piriformis syndrome and how it affects your ability to So the sciatic pain is going all the way back in the leg, and the piriformis pain is only most of the time in the buttock. When I say piriformis, it means like there is a muscle which comes from your sacrum to your greater trochanter of the hip. Okay, so you were going to see here that on the hip,
tightness and contribute to piriformis syndrome. The buttocks region is comprised of many muscles. Beneath the gluteus maximus is the piriformis muscle.
so under the gluteal maximum, there's this muscles right here. This is called the piriformis muscle. And your sciatic nerve is going from your L4, L5, L5, S1 under the piriformis muscle and then goes down to your leg. Okay, so you see this one is your sciatic nerve. So many times what happened that you misunderstood your pain, that you think it's a sciatic nerve compression, but actually it's your piriformis muscle is very tight, which compress your sciatic nerve, and that kind of cause the pain. And that pain is more localized to your glutes area. So if your pain is radiating down all the way in your leg, that's more coming from your back. But if you're localized to your gluteal, there are possibility that your pain is coming from the just the piriformis muscle. Okay. All right. Okay, so I'm gonna go back to some of the tests. Okay, can I go back to the slide? Okay. So for the sciatic pain, there is a one test, the special test is called straight leg raise, which is also called Lasik test, based on which level you're getting the pain in the back, that we can identify whether the pain is coming from your back or it's coming from the sciatic, the joint or the muscle. This is this image of like piriformis muscle and how the sciatic nerve goes down. Now, when to seek the professional help? Like, what are the symptoms that you experience, and then you wanted to see the physical therapy or primary physician or your orthopedic doctor. So basically, if your pain is lasting more than a couple of weeks, you want to make sure you see some help. You see some professional help. If your pain is radiating down to your leg, that means your nerve is getting compressed somewhere in the pathway. At that time, you want to seek some professional help. If the pain is not relieved by all the conservative way, you try all the different approach, you try like, physical therapy, you try like, some self treatment. And if you're not like, getting better, you want to definitely make sure that you see the professional help at that time. Also, if you have any kind of bladder or bowel problem, that's more severe. Now, many times I also get like some people ask me like, is surgery for you? Like, is surgery is an option for me? Should I have to go with the surgery? And it depends on the symptoms. It varies. Most of the time, the back pain can be treated conservatively, means with physical therapy, proper posture, proper assessment, we can treat that. But sometimes you have to go with that. But one of the concept is very, very, I really like this concept, is the virtual surgery. So basically, what it means is that if you go with the back surgery, you have to be bedridden, like you have to take a really good rest for at least a couple of weeks. After that, you had to make sure you slowly progress in the rehab based on the protocol that's set up by the physical therapy or the orthopedic doctor. So you have to make sure you follow all those things. And then without surgery, if you do all those things, there are high chances that your pain will go down. The reason is because in our routine life, we forget about following all the right back ergonomics and all. So if you imagine like, that after surgery, whatever you're gonna do, if you do without surgery, there are high chances that that trigger point that you have for the back pain will be gone. Okay, so that's a one way to go. But then let's say, what are the absolute reason that you should go for, you should consider the surgery is one of them is the loss of bowel or bladder control. If some infectious problems going on with your back, definitely that you should consider that. The numbness and radiating pain is not cured by conservative way. So you tried different approach, you did the physical therapy with the proper assessment, because there are sometimes like, some people don't get to some of the professional people are not assessing patients right. I've seen many times in my practice where they just look at the MRI and say, oh, this is a surgical patient. Not necessarily, because you have to really assess functionally to determine whether the patient is right for surgery. Um, so those are the things that you should consider, like, when you're thinking about surgery. Now, the physical therapy, how the physical therapy helps you. So when I have the back patient, the first thing I do is a medical history, because many times when I ask the question, I hear, like, I can get it, like, why the pain has started. I get a patient, many times they say me like, all of the, like, years I've been sitting working on the desk, and all of a sudden last week it just started, my back pain just started, I didn't do anything different. Well, that's kind of a tricky point, because you've been working 30 years, that's a stressor, and then now you're just like, your back is just giving up. So it didn't happen overnight, it was happening over the time because of your habits. Okay, so medical history is very important. We do some functional assessment to find out which muscle is tight and which muscle is weak, because based on that we prescribe the exercise. So it's not a random core strengthening exercise, but based on your movement, based on your pattern, we decide which exercise will be good for you and which will be bad for you. Okay, so, and the other skills that we use is like dry needling, cupping, manual technique, mobilization, electrotherapy, like the TANs, ultrasound. We also, some, like lately we've been, the laser therapy is very popular as well. So those are the approach that we do. The manual mobilization, I really like it. So for example, for mobilization, what we do is like, if it's a L4, L5, and if you think, okay, there is a mobility issue going on between that, so we try to stabilize your L5 and then mobilize your L4. Okay, so based on your symptoms, we will do that. We have equipment to do that. We do manually with the hands. So there are different ways we can treat the patient. So that's the physical therapy treatment. Okay, and the next one we're gonna discuss is a type of the back pain. Many times patients just say, okay, I have a back pain, I have a herniated disc. But what is that? What is herniated disc? What is stenosis? What is listhesis? All those terms. So I'm gonna just briefly explain the types of the back pain, and then we're gonna, so you can understand the terms. So the herniated disc, when you hear the herniated disc, there are basically three types of herniated disc. The one is the peripheral disc. So if someone bulge from back, like posterior, means the back side, or on the front side, on the side, that is most probably happening because of the repeated movement. So if someone's sitting in the chair and repeatedly leaning forward over and over, there are high chances they're gonna get the herniation disc in the posterior. So I'm just gonna quickly share the screen and show you the one of the herniated disc video, so you can understand like what is the herniation. Okay.
Low back pain is common and can make everyday tasks such as bending or twisting difficult. A herniated disc may be a cause of your back pain. The lumbar spine is found in the low back.
Okay, so basically in this one, you will see there is a thoracic, lumbar, and sacrum, and there is a disc between the spine. Okay, so there is a center, okay, and this is the outer side is a connective tissue that's called annulus. Okay, so whenever there is a pressure going on, okay, so this center kind of leaks and goes out. So when it goes out, at that time, you're getting the herniation disc, and that compress your spine. When that compress your spine, that's where you start your symptoms. That's where you start feeling more pain. So that's the time that you wanted to make sure that, like, that which side is affecting. Okay, so the other one, that's the peripheral one. Okay, the other one that you feel is called the collapse of the spine, the disc. So in the collapse of the disc, what happened is that your center of the spine is getting compressed. Okay, so that is a little difficult to treat, because when it collapses, basically that happens when you're lifting too much. If you're lifting something heavy or something like that, that's happened. And the other one is a disc tear. So the collagen fiber that we see in the outer side, that fiber gets tear, and then you get all the symptoms. And that is happening because of the twisting movement. If you're lifting something heavy and you're twisting, there are chances you're gonna get the disc tear. Okay. The other one I'm going to share. Okay, so this is as I'm sharing the screen, so I'm going to so the stenosis. So before I go with the other type, I want to explain the stenosis as well. So the stenosis is a narrowing of the canal. So what happened, there is a spinal cord which goes in the canal on the spine. Okay, so over the time, you get the degenerative changes in your spine. And because of that, the canal that happened right here, it gets really, really narrow. And because of that, you get the compression. And that is called the stenosis. Okay. All right. Now I can stop the screen and you can get back to the slide. So. Okay. Okay. So the other types of the disc is the degenerative disc disease. It is most common happen now over the time. Everybody gets some degenerative changes in their disc. It's normal to get that, but sometimes when you start getting more symptoms because of that, that's the time you wanted to see professional help. Okay, but if you go and get the x-ray or like some report, there are chances they're going to show you that, oh, there is some degenerative changes going on, but that doesn't mean that you have a back pain, because that sometimes is just a normal aging, but when it starts bothering you, that's the problem. The spondylolysis is some normal degenerative changes of your bone, your joint. Okay, so also as we saw in the video that you get some wear and tear in your joint, so that's the spondylolysis. The other one is a spondylolisthesis. So what happened, your one vertebra slips forward. So compared to, like, for example, L4, L5. So your L5 slide forward compared to L4. That's the listhesis, okay? The other one is a stenosis that we just saw the video. Okay, we already discussed about the sciatic nerve. Okay, so how the sciatica caused the problem, pain. The other one is a skeletal irregularity. Sometimes, like some people has a scoliosis, lordosis, kyphosis. It can be congenital. It can be caused by the poor posture. Osteoporosis is one of them. Your bone density goes down and then affects your spine. The spinal bifida is also an incomplete development of the spinal cord, which can cause this pain. Sprain, strain, trauma to the injury, any recent fall, car accident that can does the back pain. Quad equina syndrome, that is also like that when the disc ruptures and push on the spinal canal and it pressured the bundle of the lumbar and sacrum nerve roots, that's the quad equina. That can be very, very severe back pain, and it can you definitely need to see professional help for that one. And the other non-spinal related causes is more infection. Infection is a big issue, is like the topic. I think we're going to have a seminar on September for the infectious back pain. It could be ascites, like osteomyelitis, vertebral osteomyelitis, kidney problem, bladder problem. So those kind of infectious disease can cause a back pain too. And I think there will be seminar in September just on those topics, that back pain caused by the infectious disease. Okay, so they will discuss more on that one issue. Okay, so till now it was more knowledge about the things that typically people hear. Now I'm gonna go more on the treatment side, what the tips, the ergonomics, the prevention, what you should do. So if you notice that cervical, thoracic, and lumbar. If you look at the first figure, you will see the cervical has a lordosis. It's more like a curve. Then thoracic is going out and the lumbar is curved left side. This is the normal anatomical position. So we wanted to adapt this position throughout our different posture. What happened over the time, because of our habit, we start losing this posture. If you look at the next slide, you will see the different types of irregularity in our posture. So the first one you'll see is the lordosis. I don't see in that one it's cut, but the lordosis is basically your lumbar curve is increased. So your lumbar is really increased your curve. So your spine get tilted forward in that one. The second one is the kyphosis. The kyphosis is more like a hump back. What happened if you see the arrow, it going backward. So in that way, your pelvic is tilted forward. Your plumb line is going a little backward. So it really affects all your muscle balance. The third one is a flat back where you lose all the curve. The other one is a sway back that also affects your pelvic, your shoulder, your back. And the last one is the scoliosis, which is curve the spine sideways. That can be treated if it's less than certain angle. We can fix it. We can definitely improve the posture. But if it's more than certain angle, then definitely we need to do further investigation in that and more tests. All right. Okay, so the tips to help your back pain, and this is very, very commonly mistaken things that people do that they should not do. The one is the avoid high heels. And why? Because you will see the figure that the plumb, like the whole posture, you will see it straight. But when you put the heels, everything gets disturbed. What happened? Your center of gravity falls forward. So your knee has to bend because that increased height on the heel has to compensate it by different muscles. So you increase your curve in your back, your posture, your lumbar get really, really pressurized. And over the long use of high heels, it can really affect your back pain. Wearing a high heels can increase the pressure up to 25 times on your lumbar. Okay, the pressure build up from the wearing the wrong footwear can cause a back pain in the long run. Okay, so my suggestion is to wear the shoes. You want to like sneakers or properly supported footwear. Don't try to the flip flop. Don't wear it for oftenly. Sandals, those are not a good quality, like not a good support for your back. You wanted to make sure you wear some sneakers to support your feet. Also, the shoes, when you choose the shoes, your shoes has a mileage. It lasts up to 500 miles. Okay, so let's say if you're walking 5 miles a day for 5 days, okay, 5 days a week, so you're walking almost 100 miles a month. So in the 5 month, you got to change your shoe wear, because that's a very standard equation. So track your mile, if your habit is walking 5 miles a day, just calculate that way so you know when to change your shoes. Okay. All right, so the next one is the avoid sitting too long. This is very, very important, that you have to avoid sitting for more than 20%. Most of the time, we spend our day sitting. Let's just imagine your day, just sit down and think about it, that you wake up, you start your breakfast sitting, you go to the job in the car, and most of the people has a desk job. They sit down on the desk and they work 8 days of work, 8 hours a day. They go home, watch TV, have a dinner, sitting down. So we spend a lot of time. That's a survey that Americans spend about an average 13 hours a day just sitting. Okay, and if you think, if you can see me, this phone. Okay, so this phone is very light. I can hold it. I can hold it like that. But imagine if I hold for half an hour. It's gonna start hurting my shoulder, right? So the reason is because the gravity push it down, okay? So over the time, the pressure build up. Maximum pressure that you get is in the sitting, okay? If you look at the next slide, you can see the different posture, that how much pressure you get in the different position. All the pressure, the number that you see is in kilo. Okay, so that much kilo of pressure you're getting on your lumbar. Okay, if you see the first one, the laying down, you get 25 kilo pressure on your lumbar. Sideline, 75 kilo. Standing, 100. You lean forward in standing, like you're lifting something forward and you're leaning forward, that's 150 kilo. If you're squatting down, if your posture is not round and trying to lift something heavy, 220. Look at the sitting one. If you're just sitting simply in the chair, still your pressure is 140, which is more than standing. If you lean forward in the chair, which we do most of the time, even without lifting weight, if you just lean forward, that's 185. And just imagine you're trying to lift, how many times you're trying to lean forward to pick up your purse. 275 kilo pressure on your back. So imagine like, that small pressure increase over the time, and what will happen to your lumbar, your spine. Just observe the toddler, like 1, 2, 3-year-old kid, observe them. They will never slouch, okay? Just observe next time whenever you see the kid. The reason is because when you like, you're growing up, your spinal cord is properly aligned, your muscles are really balanced, okay? So look at this kid in the photo in the slide. It sit upright properly, but because of all the habits over the time, luxury that we get, recliner chair, all those things happen, we start adapting our posture in that position. Our muscles start adapting that position, and then we slouch. And then one day we're sitting somewhere and say, oh, we got to sit straight. It's going to hurt because your body is not used to it. And then you sit like 5 minutes and you start complaining back pain. That I cannot sit straight. I get stiff. Of course, because your back has been in that position for a long time. So that really affects. Now, the next line is also very, very interesting. So the next one you see, like, the neck weighs, in a normal position of our neck, weighs about 10 pounds, okay? How many times a day we adapt which position, you can think by yourself. If you're just bending about 15 degree, from 10 pound, you increase 27 pound. 30 degree, 40 pound. 45 degree, 49 pounds. 60 degree, 60 pound. Most of the time, we're just stick with on the phone. We're looking down, we're just working on that one. You're looking at checking the emails, social media, that much pressure you get on your neck. And then you, of course, because of that position, what happened, your trapezius, your lateral scapula, all those muscles start getting tightened up on you. And then you got like another kind of a humped back. So that's definitely your habits. Like, over the time you get like, like this. That's why you see like, there is the term as well. It's called text neck. Okay, so that text neck is like you've been texting with the head down. That kind of affects your neck over the time on the long run. All right. So the next slide is like sleeping with the pillow between the leg. Okay, so that's very important. If you look in a photo, that if you sleep with the pillow in between, you're aligning your hip properly, so your back doesn't get any kind of strain. If you're sleeping on the back, put the pillow under the knee, you're basically bending your knee to flatten your lumbar. Okay, if you're sleeping on the stomach, which I don't suggest, I don't recommend, but if you're sleeping on the stomach, then put the small pillow, not the big one, small pillow under the abdominal to get proper alignment. I also get like, the mattress. Like, people ask about the mattress, they need to change the mattress every 5 years. Don't use the same mattress every 5 years. You, many times I've been asked, should I use the firm, soft, or which one? There is no right answer. Based on your body type, based on your time, like, all you got to see is if you look in the photo, if it's too soft, you're going to sink in it. If it's too firm, you're going to hurt in your, like, the bony contour. So you want to make sure which one is right for you. Everybody's different. So whatever gives you proper alignment, that's the right one. All right, the next one is very important, the office ergonomics. Right now, whoever is watching this seminar, I bet many of them have put the laptop down. If you look at this picture, look at the screen, the eye and the screen, straight. Look at me right now. I'm not looking down on the screen. I'm straight. Okay, I'm looking straight. Okay, so you want to make sure you adjust your screen because you're spending the whole day on your desk. You want to make sure your screen is straight. You look at that photo in the bottom, there's a stool because your angle, your hip, your knee angle has to be 90 degrees. You cannot lower it, you cannot higher it. You see the lumbar support is properly, your lumbar is properly supported. If your chair is not ergonomically correct, use a lumbar pillow. You can use some square pillow to put it on your back. It will push your back forward and align it properly. The next one is the lifting technique. There are basically 3 lifting techniques: power lift, diagonal lift, and golfer's pick. If you're lifting something heavy, power lift, where you squat down, back straight, using your hands and leg to lift the egg-ups. Diagonal is more like, if you're something like a basket or something, you can use more like a lunge position and lift it down. And the golfer's pick is if you're picking up something from the floor, like some lightweight, you can just use the golfer's pick where you're bending from the hip and picking it up. Okay, this is the sitting posture. So you want to make sure, as I mentioned in the office ergonomics, your back has to be straight. If you cannot sit straight like that without any back support, put the lumbar pillow, square pillow, lumbar pillow to keep your back curved. Okay, and this next one is the exercise tips. What exercise you should do. So to overall prevent your back pain, you want to stay active, okay? Daily routine, make sure you're walking every day, or at least make a routine in a week that, like, you're walking every day or every other day, you're stretching, some exercise daily basis to prevent it. Avoid sitting more than 4 hours cumulatively, like, overall in the whole day, don't sit more than 3 or 4 hours, okay? Now the exercise, so what I did is I categorized the exercise. In the exercise, the first one you see is for sciatica. The next slide. Okay, so this one is for sciatica. What he's doing is not just doing the squat. So he's standing up and he's putting the hands on the chair and he's kind of hanging on it. So you get the traction on the lumbar. That's for the sciatica. Okay, so if someone has any symptoms in sciatica, this can help them. This next one is the sciatic nerve glide. Okay, so what their person is doing is in the hook line position, you're lifting your leg up, your ankle is 90-degree flexed, and then in that position, 90-degree hip flexion position, you're just moving your ankle up and down, so you're pulling your sciatic nerve. Someone with the burning pain, this is very, very effective. The next one is the sciatic nerve flossing. Okay, so this one is just like we floss our teeth. This one is flossing your sciatic nerve, because what happened when there is an impingement going on, your nerve gets shortened. So when you do this one, so what you're doing is like you're laying down flat, you're lifting your leg 90-degree, and then you're bending your knee and you're lifting your head up. Okay, so your knee is flexed. While you're flexing your knee, while you're bending your knee, you're lifting your head up. And you do repeatedly about 10 to 15 times. That's a flossing. Okay, many times the stenosis. Okay, so the exercise for stenosis, what the next slide is, it's more like a cat and camel, but exactly not the just high arch on the back to create the pelvic tilt. You don't want to do like the camel. Okay, you want it to just go backward, because as I say, like we're doing flexion exercise, because stenosis, any extension exercise is not good. So you're just tilting the pelvic backward. The next one is the knee to the chest. Again, this is a flexion exercise, so it's good for the stenosis. Someone with the stenosis, you're pulling your knee to the chest. That can really help you to avoid the pressure on your spine, and that can help you with strengthen your back. Now, these are some of the stretching. I'm going to explain some of my favorite stretch. Even I do it regular basis. The first one is called the scorpion stretch. This one is kind of mobilize your spine when you do it. So what you're doing is put the head like a pillow or something on the head. Your hands, you're spreading out to make sure your upper body is stabilized. And then you're lifting your one leg up and going on all the way other side. So that really stretches and mobilize your lower back. Okay. So this is really good stretch for morning stiffness. If you're getting up with the stretch, like stiffness, if you do this, but as I said, you should not have any other condition like stenosis or something like that, okay? All right, so the next stretch I explained is the quadratus lumborum. But this one is, if you notice in the photo, there's two arrows. You're not just bending on the side, but you're also kind of moving on the other side. So in that way, the reason he's sitting down on the floor is because in that position, the pelvic are locked. Okay, and then you really stretch your quadratus. When I say quadratus lumborum, that's a muscle attached from your spine to the hip. So when you stretch that muscle, it really helps you to reduce the stiffness. And the last stretch is just a side bending. So you're just bending your one leg. Make sure you spread out your hands to lock your upper back, and you're moving on the side to stretch your lower back. All right, and the last one is where to find the exercise. So if you look at there are so many softwares out there, but you can Google it. There are many exercises, but to find this specific exercise, once you know which exercises you need to do, then you can go in that hep2go.com. I'm just gonna share my screen because I have that ready, so I can show you. All right. Okay, so this is the software. There, as I said, many software out there, free software, but this one is really free to use by anybody. So you just type hep2go.com and you see here all those types like ankle and foot, elbow, hip. And there is on the right side, there is all the type, active range of motion, Bosu ball, cones, foam roll, balance, elastic, to closed chain exercise, isometric. So you just like, the lumbar and thoracic. So if you just go like mobilization, it will show you all the mobilization technique. But it's very, very important that you know which one, what to do, which exercise is good for you. Randomly, just don't do exercise if you have acute back pain, okay? All right, okay, so I try to cover it like, some of the topic. Now, I can definitely answer if someone has a question and answer, I can definitely answer that.
Wonderful. Thank you so much, Dr. Sanket Vyas. I think a very powerful presentation, very practical, I would say. And one thing that really opened my eyes was about the posture. You talked about the pressure, right? If you're going to sit continuously, how much pressure we are adding. That was really eye-opening. Personally, I was not even aware. It almost was doubling when compared to standing. So thanks a lot for that. I think next time I have to, that will give me a strong reason to keep getting up very frequently. So thank you for that. We do have a lot of questions coming in.
Okay.
So, request to all our viewers, please, if you have any questions, you can continue to post your questions in the YouTube chat window. Also, we have shared a Zoom link. So if you would like to, if you have a question that you would like to directly ask Dr. Sanket Vyasji, you can join the Zoom session. And once you're in Zoom, please ensure that your webcam is on and you can raise your finger on Zoom so that we will be able to locate you and you can ask the question. While we move on to the question and answer session, I just wanted to take a moment to let all our viewers know that JKyog Online has been conducting a lot of free sessions every day. This health webinar happens every Friday where, accomplished doctors in different fields, they share their experience, their tools, tips, and some prevention techniques that we can follow to avoid some of the chronic diseases as well as some of the back pain and thyroid diseases and heart problems and things like that. So please do take advantage of this. And if the health webinar happens every Friday and we stream it on the YouTube channel, please do take a moment to like, subscribe, and comment on this video if you like it. Also want to let you know that JKyog also offers a lot of other online sessions like everyday meditation session. We also have Bhagavad Gita study, Bhagavad Gita recitation. We're also going to start a new series, Life Transformation Challenge, Put It to Practice session starting tomorrow, same time. It is going to be on Zoom. Our team is posting the link. So if you're interested, these are beautiful wisdoms that Swami Mukundananda ji is sharing with us. And through the online platform, we're all learning and many people's life have transformed. If you would like to understand these tools and techniques and implement in your life, please do join these sessions. And we have for all age group, be it for children or for youth or for adults, we have programs going on. With that, let's move on to the question and answers. So the first question comes from Sumitra Kumari Jaiswal. Her question is, it's very interesting, with when we have back pain, is it okay to wash clothes by hand?
So I would say no, because it depends how you're washing. If you're just like, like soaking, it's okay. But if you're like, that typical style, you're just like, like slamming, that's not good. Because if you have any active back pain, the concept is this: any sudden movement in your back, your brain our brain works to protect your body. Okay. So whenever our brain detect that there is some awkward movement happening in our body, they send a signal to your muscles to tighten up. That's called spasm. You must have heard about like spasm. So when they spasm up on you, why? To protect your spine, because your brain thinks that your spine is it's vulnerable. It's gonna get like, some pressure. So they tighten up all the muscles surrounding or stabilizing your spine. And that's how you get more stiffness, more pain. Okay, so any sudden movement, any kind of washing clothes, it's gonna trigger more pain.
Thank you so much for that, doctor. The next question is actually a generic one. It comes from Saurabh Kumarji, and his question is, what should I do for a tailbone pain?
So the tailbone pain is the coccyx. It's called coccyx. So I also get many patients, and it's very hard, to address that, because your pain is more at the rectum area. So definitely you want to make sure you avoid pressure. So I can tell that most of the time when someone has the tailbone pain, their posture, when they're sitting, their posture is not good. If your pain is very active, I tell my patient to use some soft surface. Don't sit in a hard surface, because that kind of push on your coccyx area, and that triggers more pain. There are some manual technique that we can use. So, but if your pain is just comes and goes, then you can just simply do the pelvic tilting, and that helps to reduce some pain. But it doesn't go away by doing that. It doesn't go away by proper posture, using some soft surface, not the hard one. Don't cross your leg and sit down on the floor. If you follow all this for some time, and if it still doesn't go away, then you can definitely see some expert physical therapy, and they can use some manual technique to mobilize your coccyx. Also, myofascial release helps. Take a tennis ball. As I said, this is just a generic instruction, because everybody is different. Okay, so everybody, based on the assessment, we treat differently. But we can use some tennis ball and mobilize all that myofascial release on your paraspinal muscles. That really helps too.
Thank you so much. For the next question, we will go to a participant who's joined on Zoom, Mr. Jayesh Patel.
Okay. Hey.
Hello. Thank you, doctor. It was a nice presentation.
Thank you.
Many things we didn't know. So yeah, so I'm doing yoga every day. At the same time, while working 8 hours on the laptop, my work is IT work. So sometimes when I lift something, so at that time it pains, but it's very sometimes. So is it like yoga, and what exercise you have suggested? So is it goes in conjunction, or it's either or
No, it's not either or. It does go together. As I said, if your pain is not because of some certain condition, and if you're just getting some stiffness and some minor aches and pains, sometimes then you can combine the yoga and some of the stretching and all those things. But my biggest suggestion is to change your habit, because yoga, Pilates, exercise, stretchings helps you to reduce the pain. But unless your stressors, which is you're sitting too long and avoiding that, I can tell right now when you're on the screen, you're looking down right now, so I can see your neck is flexed.
Yeah.
So those kind of things affects on the, there you go.
Yeah, it's
those
a habit.
Yeah, those kind of changes makes a big difference, because as I say, that it's not, the phone is not heavy, I can hold it. But if throughout the seminar, if I hold it like that, it's gonna start hurting.
Correct. Yeah.
Same thing happened. Your stiffness that you feel in the morning, all this, that sitting too long. I have some videos on you got to stretch. Okay, the one stretching that I explained about the quadratus lumborum, where the other person is doing this way, you can do it in the sitting. While you're sitting in the chair in front of the computer, you can just half an hour. Even I tell my patient to set the reminder, because we have lots of feature in the phone. Reminder every half an hour, 1 hour. Just give the alarm. Just stand up. It's a reminder. Just stand up. Okay, just do the stretching. Those kind of small things can make a big difference in the long run.
Yeah. Thank you, doctor. Yeah, I remember Swamiji used to tell us every time, keep your back straight, keep your back straight. Yeah, thanks. I'll keep that in mind.
Thank you so much. We now go to the next question that is coming from Paragmita. And the question is, I have ankylosing spondylitis. What is that, and what kind of exercise should I do?
So basically they're saying as I mentioned about the spondylosis, one of the terms that I explained was a spondylosis. So the ankylosing spondylitis means you're getting the stiffness around your lower back, and it's getting some degenerative changes in your bones, in your vertebra mainly. Okay. So what you need to do is basically you need to focus more on flexibility, mobility. Your exercise should be more in doing more flexible exercise to improve your range. Okay, so there are some, like, as I said, when we see the patient, and if this condition is affecting you in your routine life for a long period of time, then definitely you should see a physical therapy. They can do the thorough assessment and they can give you, prescribe you, because if it's minor aches and pain, you can just follow the routine and you'll be okay. Okay, but you definitely, like, we need to find out which movement is causing restriction, because your ankylosing spondylitis is basically which spine, what level you have it, what level, what spine is restricting your movement, what causing that pain. Those kind of symptoms we have to take in consider. But I'll tell you one thing, in my experience, in my practice, I've seen many times with this kind of condition, when someone has ankylosing spondylitis, their pain is not coming from the spine. Most of the time, their pain is coming from the muscle. You will see, like, your pain will be more on the side of the spine. Okay, if it's in the center, that's more your spine. That's more maybe your disc, maybe your vertebra. But many times your pain is on the side. The side, we have a muscles. Okay, we have different muscles, erector spina, your quadratus lumborum, your transverse muscles, all those muscles, as I mentioned about the spasm. Okay, so when you have this ankylosing spondylitis, the brain, any movement you do it, your brain thinks your spine is vulnerable. We got to tighten up to protect it. So your pain start getting on that because of that reason. So with that treatment, as I said, like, we start with some, if you have active pain, some pain management technique, regular myofascial release. You must have heard about the foam roller. There are many stretchings available, like, you can even see in the website that I suggested. So foam roller really release the tension in the muscles. All the spasm muscle that we have, it release the pressure on that one. And of course, this is the condition where the core strengthening can help.
Great. Thank you so much for that very detailed answer. The next question is about sitting straight for meditation. Many of our viewers, they do meditate a lot. So there are two questions related to that. How to sit straight for meditation for a long time? That is one question. And the other one is related to that, but a little more specific, that Suman Vashisht ji is asking. He says he's confused as to which lumbar sport backrest should I buy for lower left side back pain, as he sits for a long time for meditation. And what is the difference between memory foam and normal backrest?
Okay, so I'm gonna try to cover the whole area. So how to improve your sitting when you're doing the meditation, okay? So it's a process. It's not gonna happen in one day, because whatever, as I said, throughout our life, whatever the habit we got into, we had to break it down. So what happened when you sit down on the floor, the anatomical position, the structure that moves on our hip and your back, I'll try to explain that. So what happened when you sit down, your pelvic tilt backward, okay? Because you're sitting down, so your pelvic tilts backward, okay? And your lumbar curve, it doesn't stays there, it flattens. And that's why, like, you start getting pain in a short time, okay? So our goal should be to maintain that curvature. Now, without any backrest, if you have a back pain, I would definitely suggest to sit with the back support, with the lumbar support. But if you don't have that, you have to train your body to sit in that position and maintain your lumbar curve. How can we do it? By improving your lumbar tilting movement. So when you sit, you're tilting your lumbar anterior and posterior, anterior and posterior. That helps you to loosen up that SI joint, your sacroiliac joint, your lumbar and the lumbosacrum joint. All those joints loosen up. The second thing that you do is, again, as I mentioned about the foam roller, take a foam roller, okay? You lay on it. I do this all the time as well. So your lumbar, you curve on that one and you roll on that one. So my simple answer is that you have to train your back to sit longer. How you train it? By improving your pelvic mobility, by improving your lumbar curvature, by strengthening a little bit your core, because you're strengthening your ilios. When I say iliopsoas, that's your hip flexor muscles, the muscle which is in front of your hip, okay? There are some exercise that I can suggest to improve that, but as I said, it's specific exercise can really help you. I can share the screen, but don't have much time. Otherwise, like, I'm sorry, I can go much detail when the question comes. I want to make sure I explain all the detail anatomically and everything. So, but anyhow, so those are the basic things you can do to improve it. Okay. Now the lumbar pillow, there are many out there. The memory, regular one, there are many out there. Memory is good. I like the memory one. I use in my car. Okay, all the time. I drive, like in the weekend, I drive a lot because I see most post-operative cases. So I drive a lot in the weekend. I keep it. I don't have back pain at that time, but I still keep it. I keep the memory form. The reason is because when I sit in there, they contour on my lumbar. They know exactly my position, that where it should be. So it really helps. But if you don't have that, the concept is like, lumbar should be curved. So if you don't have just like a square pillow, you can start with that. But the recommendation is to get the memory lumbar pillow because that really helps. Now it comes to the pain on the left side when you sit. That tells me that your left side is getting somehow spasm or tight, or left side, your pelvic is tilting. And that is the reason there is an imbalance. The one of the slide I mentioned was the imbalance between the muscle. Whenever the one side is pulling, the other side is relaxed, your pain start concentrating in one side. So that tells me that definitely you have some issue with the alignment, like your pelvic is tilting a little bit on the left side, and your left side muscles are more tighter and spasm. Okay, so there are some like, myofascial technique can release that pressure, but to be very specific to that answer, we need to see what's going on.
Thank you so much, doctor. That was a very detailed answer, and I was so impressed. You were able to remember all the subtopics that the question had, and you covered all of them. Special kudos for that. Next question is from Anshuman Ji. He has joined the Zoom session, so I will request him to please go ahead and ask the question.
Yeah, Dr. Sanket, very effective presentation. Good use of the animated videos and the pictures to drive home the point. So I think thanks to you for that. My question is, which are the best exercises for spine health? Is it yoga or Pilates or walking? And also, is cycling or running good? I mean, maybe long distance, people who are running marathon or maybe 10 kilometers or more. So is running okay for the spine health? That's my question.
There is no one answer to all those things because there are different activities that you explain. You explain the biking, you explain the running, you explain the walking, you explain the yoga. So there are all the different kind of activities, okay? So in a normal case, if someone don't have a back pain and it's a normal healthy individual, then I will suggest, yes, you should go for like, yoga, you should do regular walking. Those are more preventative care. Running, no problem, but running, it has to be very, very properly done, proper shoe wear. You should not have any issue with the knee pain or back pain because when you run, your joint kind of impact when you run, okay? So most of the runners who are like to run, on the long run, their joint kind of get lots of troll on it, okay? For run, I get many patients with the run, like who has a history of running, like they like to run, but as they age, like their joint, their cartilage start affecting it. If you do proper stretching before, like for example, one of the muscle called IT band, which is on the side of your thigh, you want to stretch that muscle before you run, because if you don't have a proper shoe wear, you may get a shin split, where the shin of the leg, you get pain on that, what's called shin split. Some microfracture happens in that one. So the running, I don't recommend it too much, but if you're running, like you're avid runner, go for it. But if your posture, your shoe wear, all has to be proper. If you have a back pain, okay, then my suggestion, if you're having a back pain on and off, okay, then you can do yoga, but don't do the poses that create more pain, okay? Because there are some, like, you must have experienced, like, if someone has a back pain and they do some activities, next day they said, okay, you know what, I don't know what I did yesterday, but I feel it today. Okay, so with the active pain, you want to avoid any activity that causing pain, because many times people has a misconcept that no pain, no gain. Even though it's hurting, let's push it. Okay, not in this case. There are some cases we need to do that, but not in these cases. When the pain is an indicator for the body, okay, the pain actually it's good, okay, because of the pain receptors, if you put your hand on the stove, you will take it off. because it hurts. Okay, so it's a good thing because it tells your brain that, okay, something is hurting. Okay, so you should not ignore that. You want to consider that in your exercise, that, okay, if this movement, because that time you have to be very, very careful that, okay, this movement is causing pain. This movement is causing pain. If I do this, you have to identify which activity is causing more pain. Based on that, you can select the exercise. Biking is, if someone has a back pain, some agent, but the safe, I'll tell you what is the safe exercise where I can suggest anybody. Biking is one of them, okay, because you're leaning forward, you're doing biking, no problem. Swimming is one of them because you're under the water, it absorbs the shocks, okay, because of the buoyancy. The swimming, the water activity is safe, it's pretty good for the joint, okay. Yoga is safe, certain poses only, except like, if certain poses is causing pain, then you want to stop that, okay.
Thank you so much for the detailed answer. Really appreciate it. Thank you.
Thank you, doctor. So the next question is a pretty interesting one. And it comes from Sanket Vyas, and he thanks you for the wonderful session, first of all. And the question is there any long-term impact of working on standing desk for 10 hours a day?
Yes, it does. As I said, even the rule is same. If you sit down, your pressure is building up. If you're standing up, still the pressure, if you remember the slide, the pressure is 100 kilo, okay? 80 to 100 kilo getting pressure. Now, the solution is this though. When you stand up, okay, of course, same rule apply. Every 1 hour, you want to stretch your body a little bit, change your gravity. Now, I suggest to all the back patients that when you stand up, you will notice like most of the desk, the standing desk has a kind of a bar in the front, okay? Or they have some kind of stool, or if they don't, you keep the stool. When you're standing up, put your one leg on your stool, okay? So what it does is, I'll show you myself here. So if I'm here standing up, if my leg is on the, like this, on this one, okay? So what happened, my weight is shifting. My weight is shifting on the left side. And now the pressure is on the left hip, not on the back. About 15, 20 minutes, change the position. Okay, I'm gonna change my leg. So now if I'm pushing this one, my weight is on the right side. Okay, so what I'm doing, I'm constantly changing my position. I'm constantly changing my gravity. So the pressure doesn't build up in the same location. If you stand 10 long on the desk without moving, the same thing's gonna happen because your body is meant for moving. It cannot be in one position. You have to keep on changing your position. That's why I said, reminder in the phone, keep on changing it. Half an hour, 1 hour, give you a reminder, okay, got to stretch it, got to move your leg, got to change your position, okay?
Very nice. Thank you so much. And special thanks to you for giving the demonstration as well. Really, really appreciate it. With that, I think maybe we can take one last question. We are almost running out of time. This question is a little off topic, but still I thought I should ask this question to you. This comes from Maya Sinha. The question is, what to eat to have a good bone density and strong muscle? And she says she's been doing yoga, but confused about what to eat.
Okay, so I won't be able to answer that specific question, but I can give you a generic answer to that. Okay, because what to eat, there is no diet for the back pain. Okay, you can eat whatever you want. There is no restriction diet like for the back pain. But to be healthy, I can tell you generic answer is that you wanted to make sure you have, because there is a recommendation by the doctor, like how much calcium you should have, how much protein you should have, how much carb you should have. You should follow the proper nutrition guideline. Normally, I suggest to mainly our Indian population, we lack vitamin D. Okay, so even myself, I do like routine checkup, and they do the lab work, and they told me, like my primary physician told me, you're lacking vitamin D. So I'm taking vitamin D weekly basis. I take 5,000 international unit every week, because our body, our Indian people in their diet, not much vitamin D. We don't go in the sun too much right now, and I'm in Texas, so it's hot. So I don't want to go outside. So anyhow, so that's diet question is very specific to your body. And that would be my suggestion, to consult with your primary physician, because based on your lab work, he can suggest you, because you don't want to overdo it. You don't want to like, underdo it. So you want to be like, very specific with that, or consult maybe one session with a nutritional therapist, because based on your lab work, based on that, they can recommend it. But in generic, your protein should be based on, like, if you weigh like 50 kilo, then you should at least have 50 grams of protein in 24 hours, in one day, basically. Your carb has to be low, of course. 40, 40, 20, that's a suggestion. So 40 carbs, 40 protein, and 20% is a fat. So it's a different types of diet available, but that's kind of generic answer for that.
Great. I think with that, we are 15 minutes beyond our time limit. But thank you once again, Dr. Sanket Vyas ji. It was very, very informative. Loved all the details that you shared, and really appreciate your patience in taking the time out to answer all the questions. And I also want to take and express our special thanks to Dr. Khandelwal ji, because he is the one who's helping line up all these sessions for JKyog. Thanks a lot, Dr. Khandelwal ji. Really appreciate you doing this. With that, we come to an end to today's session. Next week, we will continue with our Friday webinar series with a very interesting topic. So stay tuned, and please do like, subscribe to this channel if you have not done, and do like and comment on the YouTube video if you had liked this video. Thanks a lot. See you. Radhe Radhe.
Radhe Radhe.